Good morning. Welcome to our speaker series. Today, we are going to be focused on health equity and culturally competent care through the lens of several of our unique Kaiser Permanente programs. I hope you are all looking forward to the discussion and hopefully learning something new today. Before we begin, you will notice that your mics are muted and cameras are off. However, we would like to still have you interact with us using that Q&A functionality. Please do pose any of your questions throughout our discussion this morning, and we will leave plenty of time at the end to get to as many of those as we possibly can. I'm looking forward to a great discussion today and hope you are as well. My name is Allison Renz. I use she, her pronouns, and I will be your host and moderator today. I am honored to work with our large public sector accounts here in the Northwest region of Kaiser Permanente. And my team and I partner with many of our local state, county, and city government groups who share our commitment to health equity and closing the historical gaps that have existed within our underserved populations within our communities. I am continually inspired by the work that we are doing as an organization, and it is my pleasure to introduce to you our fantastic panel of clinicians and program staff that are with us today. First, we have Dr. Ruth Chang, who is a family medicine doctor and serves as the Chief People Officer for Northwest Permanente, which is Kaiser Permanente's medical group. Next, we have Dr. Jean DeHaan, an OBGYN who serves as the medical director for our Gender Pathways Clinic, which provides culturally competent care to transgender and gender expansive patients. We also have Angelette Hamilton, serving as the program director and clinic department manager for our Center for Black Health and Wellness. Dr. Peena Patel is the Chief of Family Medicine Obstetrics and the Regional Physician Co-Lead for our Salud en Español program. Thank you so much all for being here today, and let's go ahead and get started. So you will see that our agenda is starting out with an overview of the programs that I just mentioned. We will have a robust discussion where we will learn a little bit more about each of our docs and what they are up to. And then lastly, we will close out with your questions and answers for our panel today. Next slide, please. I'm going to turn it over to Dr. Patel to kick us off with our Salud en Español program.
Thank you, Allison. Next slide. Yo soy doctora Bina Patel. Yo trabajo para parte de Kaiser Permanente. Yo soy una de las doctoras de cabecera. Practico medicina familiar para nosotros pacientes que hablan español. Tenemos muchos lugares en el área de Portland donde tenemos un equipo con doctores y asistentes y enfermeras que hablan español y se pueden darle cuidado en su lengua y con respecto de sus costumbres y todo eso. Next slide, please. Wanted to introduce myself. I'm Dr. Bina Patel, and I wanted to start off speaking Spanish because many of you may not know Spanish, and a lot of our patients who come in who speak Spanish or that's their primary language, this is kind of how they feel when they walk into a place where everything is in English and everyone speaks in English. And not just our Spanish-speaking patients, but our patients who speak other languages like Vietnamese, Cantonese, etc. And we serve a lot of these patients at Kaiser Permanente. So I wanted to first start by introducing myself. I'm a family medicine doctor, and I've been practicing family medicine for over 20 years, mostly and with a focus on the Latino underserved community. That has been my passion since the very beginning. I started in community health, working only with Spanish-speaking patients, and then I moved over to Permanente about 12 years ago when I realized that Permanente did have salute modules within there where I could focus and really provide care for that population. We do have many locations around Portland where we have teams of doctors and medical assistants who are bilingual, speak Spanish and English, and provide culturally competent and linguistically competent care to our Spanish-speaking and our Latino population. Many of our Latino members might identify as speaking English, but actually they, when you start talking to them, they do prefer both languages. So it's nice to also understand kind of the culture and the background that they come from. And a lot of our physicians, have been doing this work for many, many years. Next slide. I also wanted to introduce just our interpreter and translation services because those Spanish is one of the primary non-English languages in our service area. We have many other languages, including Russian, Cantonese, and Vietnamese, especially being the top four. And I have many patients, who speak many, many other languages, probably 15 to 20 different languages on my own patient panel. So we have interpreter services available at no cost to members. They're available 24 hours a day, 7 days a week when patients call in or when they come in to seek care. And we do tell them that it's their right to always use an interpreter. There are definitely benefits to medical interpreters, and for my patients who don't speak English or Spanish and other languages that I don't speak, I always encourage them to use an interpreter because interpreters have medical vocabulary that their family members may not have to interpret. And it's just a neutral person who's objective, who can help to translate back and forth. So you're giving the best care to patients. Other benefits are that they just follow standards of privacy and confidentiality. And this is really important in providing care to our patients so that they feel safe and heard. Next slide. And I'm going to hand it back to Allison.
Thanks, Dr. Patel, and we'll look forward to learning a little bit more about the Salud program later this morning. I'm going to go ahead and send it over to you, Dr. Dahan, to share some more with us about the gender pathways.
Great. Thank you, Allison. My name is Dr. Dahan. My pronouns are they, them. I am an OBGYN, but I also am the medical director of our Gender Pathways program. I have been at Kaiser Permanente since 2018, and I've been working within the Gender Pathways program for the last 2 years. Previously, I was taking care of many trans and gender diverse patients within the OBGYN department, and kind of formally moved over more recently to do the majority of my time within Gender Pathways. Gender Pathways is located on the Interstate campus, but we provide a lot of our care virtually. So which is great for patients because they can not have to worry about traveling or, it's convenient for them. But when they want to have an in-person visit or they need an in-person visit, they have a space that is dedicated just for them. We have 6 physicians who work within the Gender Pathways program, and then a couple more who provide gender affirming care in primary care settings who do work closely with us. And we also have 1 LPN, 1 RN, we have an MA, we have 2 social workers, and we also have a community navigator who helps connect our patients to services. things that we provide at the Gender Pathway Clinic. So we do a lot of hormone management for people. We thank you for that. You can advance to the next slide. We provide with surgical referrals as well. So some patients are looking for gender-affirming hormones. Other people are looking just to get connected to, you know, a primary care physician or a mental health therapist, or don't necessarily need any gender-specific medical care, but need kind of help coordinating their care and making sure they're accessing providers who are going to be culturally competent with them. The surgical referrals we offer some of them are within Northwest Perm, and some of them we refer out to our community partners, such as vaginoplasty, phalloplasty, facial feminization. We're sending out to OHSU and to Legacy. So we work very closely with other hospital systems as well. We also offer, I'm a obstetrician gynecologist, so I offer full OBGYN care within the Gender Pathways Clinic itself. So I have a lot of inpatient face-to-face visits where I can place IUDs, do endometrial biopsies, fertility counseling, OB care, you know, anything that falls within the OBGYN kind of scope of practice, I'm able to do there within Gender Pathways, which patients have really liked because it's a neutral space. There's no gendered waiting room. There's no kind of implication about identity when you're being seen there. And so it's been a pretty fantastic service to be able to offer our members. Next slide. Great. So we kind of went over all the things that we provide internally. If a service isn't offered at Northwest Perm, we have many different ways of making sure that we can provide that care. And recently there's been legislation passed that has expanded insurance coverage for gender affirming care, which has been fantastic. And the Gender Pathways program has been working very hard to make sure that we're able to provide all the services that are now thankfully mandated legally. And I'll send it back to you, Allison.
Great. Thanks for that overview. Again, looking forward to learning a little bit more in our discussion later today. I'm going to turn it over to our duo here. Angelette and Dr. Chang are going to give an overview of our new Center for Black Health and Wellness. I know there's many people on this call who are really excited to hear the updates on this program. So I'll turn it over to you both.
Hi, good morning, everyone. My name again is Angelette Hamilton, and I'm the Program Director and Clinic Department Manager for the Center for Black Health and Wellness. I've been with Kaiser Permanente for a little over 8 years, and we have collaboratively been working on building out the Center for Black Health and Wellness for a little over 2 years. I do work out of the East Interstate campus here on the 3rd floor. And I could tell you a little bit about the center. So the Center for Black Health and Wellness, we are located on the 3rd floor of East Interstate campus. And we have really built out the center to really reflect the patients and the members that we have and are looking to prioritize within the center. This is a new option for members. It's not something that we're forcing upon our membership or patients, but this is an inclusive clinic and another added option for our members to seek services if they wish to do so. It is built and has been built out for and with a culturally specific lens. And so what that means is we really are providing culturally specific care and services to our members, and we'll talk a little bit as we get further on what that looks like. The purpose of the center is really to continue to build that trust and camaraderie with our community and our patients between our physicians and back office staff. It was really important for us to curate a space and place for our patients to be able to access the care and services that our patients have vocally said that they've wanted. Great. And we can go to the next slide. All right. And so some of the things that we really wanted to focus on, as we know that we have opportunities within our healthcare disparities, is really the blood pressure control and medication adherence, as well as diabetic retinopathy exams and kidney health. And so as you can see here, there are some disparities between our white and Hispanic or Latino members as regards to our Black members. So we do have some opportunities to be able to address those. And so we have created some specific workflows, which I'll talk a little bit as we get further into the presentation about what those are, really focusing on the diabetic retinopathy screening. We've also included dental oral health screenings and have worked in partnership with pharmacy and other departments to address those overall care gaps. We can advance to the next slide. All right, and Dr. Ruth, I'll pass it off to you.
Great, thank you so much, Angelette. So in this slide, we're really sharing the cancer screening rates for our Black members, and this was part of the business case of why we felt like we needed to have a center to deliver better care. We can see that overall, these are our breast cancer screening rates, the cervical cancer and colorectal cancer. And just to give you a little bit more context, per the National Cancer Institute 2021, which is the most recent data set around cancer screening across US, for breast cancer screening, about 76% of persons needing breast cancer screening are up to date. So we see that we clearly have an opportunity to improve breast cancer screening rates. However, we also know that in some areas we are doing better than general population. So for the cervical cancer screening rate, again, across the US, the general screening rate is 72% of people needing cervical cancer are up to date on screening. And you can see that even though our numbers dropped a little bit from 23 to 24 for cervical cancer screening, we're still well above national averages. However, ideally, we have everybody screened who needs to be screened. And then in the colorectal cancer screening category, nationally, only 59% of adults over age 45 are up to date for colorectal cancer screening. And the Healthy People 2030 target is 68%. So we're well above even that Healthy People 2030 target. However, the more screening we do, the more lives saved. So that's our commitment, is to really have maximal screening of our populations. So back to you, I think next slide, and then back to you, Allison.
Great. Thank you both very much for that overview. Like I said, I have been hearing lots of feedback from our groups and broker partners who have been really excited to learn more about the center. And we're just so appreciative of all the work that has gone on to stand this up. So why don't we go ahead and transition to our discussion. How's this going to work? I've got some prepared questions. And so just to remind our panel, I'll start with a question for one of you, but then really would welcome others to chime in if you have anything to add. And let's start it off with Dr. DeHaan. So Dr. DeHaan, you gave us a nice overview, and you mentioned about how important it was to sort of reflect back the care and support for our transgender and non-binary members. So I was hoping that you could tell us a bit about the gender affirming care best practices that our practitioners use to help ensure that they are showing up in an inclusive and supportive way. Secondly, is there any special education for our member-facing staff that helps support this?
Thank you, Allison. That's a great question. And I think there's kind of two components to it. The first is the medical side of things, and then the second is the cultural humility side of things. Obviously, they're related, but when we think about standards of care, which is the first thing you brought up, all of our physicians adhere to Standards of Care 8, which is a document that was that is updated relatively regularly and recently by the World Professional Association of Transgender Health. And it is a very exhaustive PDF that is available for free and is being translated into many different languages, that goes into things like hormone care, cultural considerations, surgical considerations, and has a very detailed guidelines for physicians. So we use that in terms of what surgeries are we advocating to be covered, which dosings are we using for medicines. There's other resources like Transline and UCSF Center for. I rely on relatively frequently, as do my colleagues. And then we all meet regularly to talk about cases, that bring up questions. Every patient, every person is different on their journey, what they need, what's relevant to them. And so oftentimes it does take a collaborative approach, both with doctors and sometimes with social workers and the support staff, to say, how are we going to meet this patient where they are and provide the care that they need, which might look very different from, the patient who's coming in before or after them. In terms of kind of any patient facing role, that obviously we're getting more into the culture of humility and how do we make patients feel safe, seen, affirmed. And that is an ongoing process. Myself, I come from a positionality of a transmasculine person. I am a white person. I am, have a MD. We all have these different positionalities that are going to affect how we interact with people or patients who are experiencing systematic marginalization. And so it's a constant process of checking yourself and educating yourself. And it's not something that you can do and complete. It needs to be ongoing. So that requires a lot of personal work, and I empower people who are interacting not only with patients, just with people out in the world who want to be allies, who aren't part of the given population that we're discussing, that they educate themselves. And there are many resources available to do that. Northwest Perm, or Kaiser Permanente, I should say, just created an online module for trauma-informed care practices, and there's a lot of overlap there, and there actually are some examples of trans and gender diverse patients within that I helped write. But it really, I think, reiterates a model that with marginalization, with oppression comes trauma, and how do we navigate that with our patients, and how do we hold them and support them through those processes. And part of that is looking at your own biases, looking at the things that you don't know, and being able to address them. One of the resources I often refer people to, and this is anybody, clinical, patient-facing or not, Fenway, the Fenway Institute has a program called the National LGBTQIA+ Health Education Center. And you can literally just Google Fenway Health, and there are so many different modules that you can sign up to do. Some of them have continuing education credits, some of them don't. And they are an incredibly wide variety of educational opportunities. So I send people there pretty regularly if they're looking for ongoing education, something they can click and do a module whenever they have time. So that's kind of where I would start.
Great. I really appreciate the terminology that you used around positionality, and that we all have probably some form of that in any given setting. I was wondering, I think one of you in your overviews mentioned the importance of having like community navigators or traditional health workers. And I'm wondering if either maybe Angelette or Dr. Patel, you could talk about the work that they do in conjunction with your programs.
That's a really great question, Allison. I started my career with Kaiser Permanente as a patient navigator. So I have a little bit of insight in how we were embedded and a part of a multidisciplinary team. and really worked in partnership with the physicians, social workers, behavioral health consultants, as well as the patients, and really just worked to empower them being our patients, in being able to vocalize what it is specifically that they're needing and or wanting within their care or from their provider or from accessing services, and working with, if they had a caregiver, just showing them how to access those services and what those pathways look like, and how they can partner with their physicians to arrive to a mutual agreement in how they wanted their care to look like. In addition to that, knowing what services are available both internally and externally within Kaiser. And so we partnered a lot with Join, for example, and helped our patients if they had difficulty paying rent, or if they had experienced houselessness or food insecurity, really making those tangible referrals and ensuring that our patients and members got the help that they needed.
Fantastic. Thank you so much. I'm going to get to another question here. Dr. Patel, this one is for you. Can you tell us about the health disparities that exist within your patient population and how the Salud teams are working to address those disparities?
Yes, I'd be happy to. That's a great question. I don't have specific data right now on a slide, but historically, we know that patients who are Latino have lower rates of cancer screening, for example, colon cancer screening, breast cancer screening, and just in terms of being able to access health, being able to come in and get preventive screening and be able to get screened for things that they're higher risk for. So Latina patients are definitely at higher risk for diabetes, hypertension, cardiovascular disease, and they tend to have more aggressive forms of these diseases where they progress a lot faster than other populations oftentimes. And so being able to provide this care in Spanish to them makes patients feel safe and allows them to establish kind of a trust relationship with their team that helps them keep coming back and getting the care that they need. And I think that is really important. Just wanted to give you kind of a quick story about how a patient feeling safe. The other day, I had a patient who was a new patient to me, and I walk in the room speaking Spanish because I know that that's her primary language. And I can always tell a patient suddenly like relax and feel at ease when you speak in their language, And about halfway through the visit, she said to me, I am so grateful that I have a Mexican doctor, it's so wonderful. And, I'm not Mexican, although a lot of people think I might be, but, and that was definitely a compliment to my Spanish, which is probably not as good as most Mexican Spanish, but it just showed me that she felt comfortable with me. And just, I'm so grateful to be able to provide that kind of care for patients and really kind of be at their level where they know that they can communicate with me directly. And all our physicians who work and speak Spanish and are bilingual do this kind of care because they really feel like it's kind of their life mission or passion to be able to provide for this community that is historically kind of underserved medically.
Love that story. The downside of Zoom is that you couldn't hear everyone. I think grinning or giggling at that anecdote that you shared. That is wonderful, and what a great example of really meeting someone and seeing them. Any others? I'll just kind of put it out either to Dr. Dahan or maybe you, Dr. Chang. Anything you would like to add to what Dr. Patel shared around sort of meeting our patients where they're at?
I mean, I'm happy to speak to that's a funny example, Dr. Patel, of identity concordance, or perceived identity concordance, I think makes a huge difference for patients. I am queer and I am trans and I am very clearly gender expansive. And sometimes when people see my name written down, that's not what they're expecting. And they maybe assume that I'm a 65-year-old cis man, which is usually what happens. And I walk in and you can see patients visibly relax. They're like, oh my gosh, I just feel so much better. And that is why I came into medicine. I went to medical school out of the coordinator at the LGBTQ center here in Portland, and I was doing a lot of cultural competency education for providers. And I realized that there was nobody who looked like me that I was talking to, and that there's only so much that you can teach to somebody about a community who is not experiencing it, who is not a part of it. So that's why I went to medical school. And now when I get to walk in a room and I can actually say to my patients, I understand, I hear you and I get it. There is a lot of unspoken, therapeutic value to that, just that they know that they don't have to explain themselves. And obviously, when you look at the matrices of identity and oppression, there's going to be stuff that I don't understand 100%, right? As we talked about positionality before, I am very aware of that, but just having some overlap for patients is I think very healing.
Absolutely. Another really powerful example. And, it made me wonder, Dr. Chang, if you could actually speak to the recruitment efforts that seek to, sort of draw in those more diverse clinicians and staff, because clearly it makes such a huge impact for our members and patients to see themselves reflected in those giving them care.
Yeah, thank you, Allison. Absolutely. So I'll just share a little bit of story personally and then talk about more of our national recruiting efforts. So I'm a family physician, been practicing with Kaiser Permanente since 2005. And I've also experienced that, having the kind of concordance, language concordance. I speak Mandarin and Fujianese, and just being able to see patients completely relax. I've also had patients tell me, they're like, oh, I take 3 buses and cross the river to come see you. And we know that's a big deal because nobody in Portland crosses the river willingly, right? And so to me, that's such an incredible honor and a compliment. And at the same time, as serving as the chief people officer, I'm thinking wow, we should be recruiting physicians who have language skills so that we have them at every clinic. So patients don't have to take 3 buses and cross a river to find someone with language concordance. And that really is our goal and our mission, is we want our clinician populations, our physicians and clinicians, to be as or more diverse than the patient population that we serve and have language concordance. So number one is we do have a language stipend incentive. So for physicians who speak Spanish, Vietnamese, Russian, and pass a language certification test, then they do earn an additional stipend. So it's our way to recognize, to encourage, and incentivize our physicians to really upskill in language and make sure that they know all the medical terminology so they can speak directly with patients. That's just invaluable for our members. And then certainly we need to recruit nationally because honestly, in state of Oregon, we don't train enough physicians to replace the number of physicians retiring in our state, so across specialties. So for many decades, Oregon has had to recruit nationally. And as part of that national recruitment, we are intentionally recruiting for diversity. So very much our recruiters are out there talking about our language incentives, about the fact that we value diversity. We want to bring in a more diverse membership. We also intentionally recruit at conferences such as the National Medical Association, which is historically the Black and African American Medical Society. So there's ways that we are intentionally increasing the diversity of our clinician population. And I'll link that then to the Center for Black Health and Wellness. This is an area that is we're very passionate about, is how can we increase the pathways for underrepresented minorities to pursue a career in healthcare. And part of that is we invest in early. So we have something called the Hippocrates Circle program where we mentor 8th graders So really young students who have expressed an interest in healthcare, and we directly connect them with our physician mentors, and Dr. Meena Patel serves as one of our mentors. So thank you so much, Dr. Patel, for being a committed mentor to that program. And the idea is then we partner with the Fabian School in North Portland. So historically, with a higher percentage of Black and Latin population students, and we're really encouraging them to pursue that career in healthcare. In addition to the middle school program, we have had high school internships as well as scholarships to go into college. And we've also partnered with our local medical school, Oregon Health Sciences University, to offer mentoring program for their students of color. So those are the ways that we can really support the entire pathway to help more diverse people and faces and people who speak multiple languages to come and practice with us. So that's been our commitment.
Thank you, Dr. Chang. And I just wanted to add as well, just in specific to the Center for Black Health and Wellness and recruiting on the health plan side, we worked in partnership with our national legal and local labor and developing job descriptions that would ensure that we would get applicants and candidates that were reflective of what our community has asked, and specifically asking for Black physicians or nurses. And so there has been a great deal of intentionality as we built that out and have made that promise to our members.
Fantastic. I know there's a lot of parents out there that are thrilled to hear that you're recruiting our kids to be doctors. I would be thrilled if my child was interested in going into medicine. I wonder, Dr. Patel, since Dr. Chang mentioned you're one of the mentors, could you sort of share what that looks like?
Yeah, it's super fun. I've been doing it at least for the past couple of years, and it starts, I think, around January, and there are about 6 or 7 meetings. You're paired with 1 or 2 students, so you really get to know them well and get to kind of ask about their family and share stories, and then there are different workshops. So there's like a casting workshop where the kids get to cast each other's arms, and it's kind of fun to watch middle schoolers mess around and do that, but also be really serious about it. And they have a trip over to OHSU to take a look over there, and they got to get a tour around Sunnyside, which is one of our hospitals. But really, what's great is being able to have that kind of relationship with a middle schooler, because that is kind of very delicate and vulnerable time for kids. And I just, as a family physician, I really love that age myself. But it's just nice to be able to relate to them and let them know kind of this path is available, and answer kind of all the questions that they might have, as silly as they might think that they are. No question really is silly, and just to show them all the opportunities that are available for them, and kind of empower them, because a lot of these kids don't necessarily have other role models, or they might be the first in their family thinking to go to college, etc. So it's nice to have that connection available.
Thank you. Thanks for the work that you're doing with our youngsters, and appreciate you sharing them. Angela, I'm going to ask the next question of you, because you sort of touched on it a little bit in the previous discussion, but you mentioned that our members have been asking for certain things, including Black physicians. Can you talk a little bit more about what the community involvement was like to stand up the center?
Yes, that's a great question. So we have really started this process, I would say, as early as 2016. We had, and this was a jump off from our health equity bus tours. And so through that, we learned that we have some opportunities in regards to the healthcare disparities. And so from that tour, we were able to hold 4 African-American healthcare co-designs, and that comprised of some of our KP members, as well as non-KP members and community entities, such as, like, for example, Self Enhancement, Urban League, Multnomah County, Healthy Birth Initiative. And we took that information and really held some ideation time and heard feedback. What do you want to see? We listened and heard about what patients' specific experiences have been, whether it was present time or historically. So fast track to about a few years ago, took that information, I never let it go. And we have also since then developed the Black Health Advisory Council, as well as CAPA, which is one of our BRGs here internally within KP, and took that information. And guess what? The same things rang true today as it did in 2016 in terms of what the expectations are, the hesitation in accessing services through Kaiser. And so we have really been, again, intentional. I love that word because it's true in terms of how we really built out this program, and will be providing services to members through the Center for Black Health and Wellness. And so a lot of discussions, a lot of reassuring that this is not just an initiative, but this is a program that is here to stay, that this is in partnership with both Health Plan and Permanente, labor, and community. And so that is how we have built this program out, from literally from the ground up, and listening to grassroots, listening to our patients, listening to community, and acknowledging the opportunities that we see with our healthcare disparities within our system.
Thank you. Dr. DeHaan, I'll share when I first started at KP over 6 years ago. There was a whole, welcome orientation, and that included a very powerful presentation from one of our members who contributed to a sort of community board for the Gender Pathways Clinic. I'm wondering if you could also talk to us a little bit about how you incorporate that voice of the member to enrich your programming.
That's a great question. There's nothing formal right now, but I feel like I was just explaining recently the kind of knack that us as trans people have for advocating for our own healthcare. And I think that has been born from gender affirming care was so non-existent in any formal way. I started 19 years ago at the Trans Identity Resource Center as a program of outside in. And we were a very small part of this nonprofit. And we had a drop-in center, and we had a literal desktop that had a Word document on it that was called Resources PDX. And it was a list of doctors that didn't have any formal training. There was no formal training, that had just been vetted by community members to say that not, this provider knew a lot about gender affirming care, but just that this provider would listen to me. Because so many of us had to say, this is the dose of this medicine that I need. This is the lab that I need you to order. And there was a list of providers who were kind of at the forefront of being willing to have those conversations. So I think from that, combined with kind of institutionalized transphobia and the unfortunate constant need to defend and validate ourselves and our existence that happens every day, and is at varying kind of heights of varying intensities given the year. But because of that, I feel like in general, trans and gender diverse patients are very vocal about what they need. And I feel like our providers are very willing and to listen and to advocate on behalf of their patients. And so, that's what, as physicians, we are there to do for them. And that's why having a protected space, I think, is so important, so that they know when they walk in or they log into their video visit or they get a call from their gender doctor, they're not going to have to explain anything, with it, less so than they might expect otherwise, that doctor is a safe person that they can say, hey, I got this denial, or I need to see this, or I want to get my injections done in this clinic with a nurse that I know. And then we're able to come as providers together, and either the patients tell me directly, or they tell their other docs, and then they tell me, so that I can advocate for the things that we need. So we don't have a formal process. I mean, of course, every department has the ability for patients to put in a formal complaint if there's something they feel like needs to be escalated. But I feel like our providers and our back office staff do a fantastic job of creating a space that is safe, that patients feel like they can say, hey, I need this, and we are able to accommodate that.
Wonderful. And the word that came to mind as you were speaking was community. And I don't think that many of us would equate the place that we go to receive medical care necessarily as a community, but clearly you and your team have created that, which is really wonderful. Dr. Chang, did you want to add something?
Yeah, I just wanted to jump in and add. I would say that the Gender Pathways Clinic was created in response to patient voices. So it was in 2015, I was then serving as the medical director for diversity, equity, inclusion. And I started hearing from patients as well as our employees when they were experiencing care as patients that they found it was really challenging to find clinicians well-versed in gender affirming care. And they also at times really face microaggressions, and felt unsafe while seeking even routine care, not even just gender affirming care, but even any routine care. And there was one story, an employee, while she was waking up from her colonoscopy, she overheard her care team questioning her gender identity, just absolutely devastated by this experience. And she shared it with me, and I was heartbroken, on her behalf, and just knew that as a whole system, we can and we must do better, right? And so that patient interaction really lit a fire in me, and just started hearing from more patients. And that's where the idea of the center was born. And at the time, we had Dr. Stephanie Detlefsen, who practiced primary care and had a deep expertise in gender affirming care. So she became the first medical director for our Gender Pathways Clinic, and I helped broker that agreement, alignment, sponsorship for our Kaiser Permanente Northwest to dedicate and open the center. So that was the birth of Gender Pathways Clinic. And then as I was sharing that story to Mr. Ron Scholes on the community equity bus tour the following year, he turns to me, he goes, great, we've got Gender Pathways Clinic. We need a Center for Black Health and Wellness. So those conversations started. But then, come 2020, a little thing happened called COVID. So all that work got put on pause. But then 2 years ago, as Angela has pointed out, we really worked in full earnest to get this center opened, and we're so pleased now. We have 3 physicians hired, a team lead nurse, several LPNs, fully staffed for the center. So we do listen to our patients.
I'm sure you all have had this experience as well, but when you tell people that you work for Kaiser Permanente, whether it be at the grocery store or one of your family members, they want to share some feedback with you, hopefully positive, but sometimes, opportunities. And I do always tell people we really do listen to the voice of our members. And those are a couple of really great examples of how the voice of the member turned into something that really impacts the community as a whole. So thank you just so much for the work that you do to meet our members where they're at. I want to ask the next question to you, Dr. Patel. Culturally competent care goes beyond just speaking someone's language. Can you share specific strategies or examples of how you address cultural beliefs, socioeconomic factors, and varying levels of health literacy in your patient care?
Absolutely. This is a great question. And again, this is one of the reasons I love working with the Latino community, because there are just so many layers there. And I think it's really important to not just figure out someone's preferred language, but which country do they come from? You know, Mexican culture is different than Guatemalan, different than Salvadoran, Venezuelan, et cetera. What level of education do they have? Because you might be giving someone a prescription in Spanish, but they may not be able to read at all. And I have patients who can't read. So these are the things that I kind of bring out in appointments with patients. And one example I wanted to give you that's kind of related to this is a lot of our Latino community kind of feels like they learn better from each other and in community. And I know we've been talking a lot about community during this webinar, so I wanted to give an example of how the organization has really supported me and a few other physicians to do a different kind of model of care. And so for the past year or so, a few of us at a few different sites have been doing group medical visits for our Latino patients who have diabetes and then pre-diabetes, so two separate groups there. And these are done only in Spanish, and they're offered to Spanish-speaking patients who are already paneled with us. So they already have a relationship with us. And through these group visits, I can tell you that I've had, patients who have diabetes, who are Latino, who mostly speak Spanish, and some of them speak English, but also Spanish. So they've also come to these visits. And these are patients who I've known sometimes for years and have been struggling one-on-one to help them bring their A1Cs down, which really, we want that A1C to be less than a certain point, which is 7, to prevent these diabetes complications, which we know this population is at higher risk for. And when they come into the group, it's really an empowerment model. And so I'm a facilitator, and I might have information, I might be a teacher, but I'm not running a class. I'm asking the patients what they want to know, and then I'm trying to elicit answers from other patients who might know the answers, so that they can teach each other and I can help to support them. And these groups, the patients who are coming to these groups keep coming to these groups. Like, one of my patients had a sick child last month, and she was like, I just really wanted to come to this group because I wanted to, they like the social aspect of it. And every single one of these patients, we've brought their A1Cs down to very close to or under the goal, which has been hard to do one-on-one. And so just being able to think out of the box and have a different model, and a model that appreciates that our Latino community members really thrive best in social groups, in person, with each other, has really improved their health, long term. And I have lots and lots of stories of patients and testimonials, about just how much they rave about having access to these groups and are so appreciative of it. So it's wonderful to be able to provide that kind of care.
Love it. It's so creative, outside of the box. I am wondering, Angelette, if you have maybe some examples of how you've gotten creative in removing barriers for our Black Center. I know that a big focus was making it easier for people to access healthcare. Can you talk a little bit about that?
Yes, absolutely. So I love what Dr. Patel said about we are in a position to empower our patients. And so through the Center for Black Health and Wellness, we're hoping to continue to be able to partnership with our patients and empower them to be able to access the services that they are wanting or needing. And some of those specific questions were, wanting a Black provider. So we have a provider, 3 providers that will be able to meet that need. But also, in addition to that, we talked about the healthcare disparities around pharmacy adherence or medication adherence, and working towards reducing care gaps around diabetes management and hypertension. And so a lot of what we heard from patients too was time. I don't have the time. And so empowering them and enabling them that time, we are going to, some of the workflows that are different than what we traditionally see in our primary care settings is we'll have blood draws that will be done in the exam room. So when we have those care gaps and we're looking to get that new A1C number to find out where they are in their journey with managing their diabetes. We're able to not have to defer them to go to another area of the building, but we're actually able to kind of have that one and done approach and do those lab draws in the exam room. Another opportunity that we know that we have within Kaiser, just that we're experiencing across the nation with our mental health and opioid addiction, we often heard from our members, wanting to have a Black mental health therapist and not really having a real space or a resource to be able to find that information. And so through this process in partnership with mental health, we were able to create a SharePoint, and you're able to drill down. It's like a Tableau report, and by zip code, by race, by specificity and what their strengths are in terms of their training, you're able to locate now a Black provider. We are a multidisciplinary team, and so we were also gifted through partnership working with a community peer support specialist who knows how to navigate both the mental health side as well as the addiction medicine piece. And we know how important cultural specific mental health addiction is for our members. And so I'm curious to know how that's going to play out for us now that we have those resources that are readily available for our members, and we don't have to guess or give a patient a call back, but we have that information now at our fingertips. So that's something that is completely different and has not been done before. To address our diabetic retinopathy screenings, that's another one of our care gaps that we look to close. We have workflows that we've created specific to that, and being able to share with our members that it's a 5-minute picture, and also communicate the importance and the why of needing diabetic retinopathy screenings. I shared a story. A very well-known individual in our community works with youth and is really business savvy, but did not get diabetic retinopathy screenings and is now going blind. And so for me, I want to make sure that we educate, empower, as well as share with our patients the importance of taking that time. It may seem like it's an eternity, but literally it's a 5-minute picture. And so making sure that we're providing that space and place where we could give this information to our patients and give them the decision of whether or not they want to move forward. Another thing that's different with our center is, with the medication adherence, right? We can't manage our diabetes or our hypertension if we're not taking our meds. And so really digging deeper and kind of getting away from the word of non-compliant, but looking internally, how can we support our members, right? We know that time is of the essence. We know that we have, 20 minutes or so to talk with our patients about what their care needs are. And so we have created a workflow in partnership with pharmacy in which, before or once the after visit summary is provided to a patient, the prescription is already have been sent to the pharmacist or the pharmacy department. The patient will just go pull a number and meet the pharmacist within about 5 minutes, and their prescription will be ready. So the hope with having this workflow, and we'll trial that out, is that patients will have less time that they're waiting, as well as be more likely to get their medications, as well as encourage for folks that have maintenance meds to sign up for the mail order pharmacy and share how, again, that will also provide them some time or give them some time back. The other thing is dental. So that's another opportunity and fear that a lot of our patients have expressed. And so we have what we call a dental questionnaire that we're going to be implementing. And that's really asking patients, where they currently are in their oral health history. Like, do they have any current dental pain? When was the last time that they had a screening? And so we're really focusing on our diabetic patients and wanting to make sure that they get their cleanings done at least every 6 months, non-diabetic patients at least every 12 months, and really introducing and folding in that the medical dental integration, right? We use these fancy terms, but are we actually actualizing, what that means, and having that partnership with medical? And so having a LPN dental assistant that's hired that will be working specifically with our underserved populations. And so that's one way that we're creating both the partnerships and then really optimizing our integrated system to work the way that it needs to.
Thank you so much for sharing that. And I just want to say, if you ever need a job on the account team, we love talking about medical dental integration, and you just nailed it. So it's so powerful, such a powerful example of how that can really impact someone's overall health. So thank you so much for connecting those dots for us. Again, I love the creativity, and I know our members are going to be thrilled to have these options. It's just really cool to see. I want to take a quick pause from the discussion. I think we could probably go another hour or two, because you all have so many great stories to share. But I do want to just plug for the audience. Please enter any questions that you might have for our panel into that Q&A functionality. We will have some time here in a few minutes to go through some of those. So please feel free to ask our panel anything that you may be wondering about that you either heard today and you'd like to hear more about, or something that we have not yet gotten to. So there's my plug. Coming back to the discussion though here today, Dr. DeHaan, I was hoping to ask you this next one. Could you talk to us a little bit about the different types of gender affirming treatments that are available? And then to take it a little step further, how do you work with your patients to recommend which ones would be appropriate for them based on their individual needs? And perhaps you could, share an example of a patient that you've worked with and how this has impacted them.
That's a good question, Allison. There are many different ways that people might access gender affirming care. And I think probably the most important thing to note is that some people want to access some of them and not others. And there is no kind of linear progression into any end goal for many patients. So things that we do offer, gender affirming hormones, and that could be either estrogen, testosterone blockers, or testosterone. We do have pediatric patients that are on hormone blockers as well, managed by our peds endo. They're actually not housed inside our clinic, but that we work very closely with. We do top surgery, so gender affirming chest contouring for folks, breast augmentations. Here within Kaiser Permanente, we do gender affirming hysterectomies, oophorectomies, we do orchiectomies, all within our own kind of institution, and then we refer people out for facial feminization, facial masculinization. We are internalizing body contouring currently. We are going to internalize facial feminization surgery as well. Some of the more complex genital surgeries, phalloplasty, metoidioplasty, vaginoplasty, those all go to outside institutions right now. In terms of what does a patient need, I let the patient tell me. I have very open-ended questions about either someone's coming to me to discuss hormones or if someone has a specific surgical request. I let them tell me what their goals are, and then we can work together to say, okay, well, how can we help you? What might be the best next step for you? I think something that has been really fantastic for patients that I've seen even recently is that I don't have a prescription for what their gender identity should be or what their path should look like. That is entirely up to them. So, I had a patient recently come to me and they were like, I am non-binary. I want my chest to look differently, but I don't know that I want, I want it to be kind of more androgynous and I don't want to be on testosterone. And I just assumed that because I wasn't going to go on testosterone and have complete chest contouring, that I wouldn't be offered services. I wouldn't be able to do that. And they were hugely relieved to hear that that's great. We're happy to meet you where you are. And if that's what feels gender affirming to you, then that's what we're going to support you in doing. Same thing for hormones. Some people want to microdose hormones. Some people meaning that they want to be on very low doses and just kind of see how they're feeling. And they may want to stay on very low or microdose dosing indefinitely. And that is totally fine. And we love that for them. Whatever somebody feels like is going to make them feel more kind of at home in their body, I am 100% there for. And as an institution, so are we. So I think that is really relieving for patients, and they realize that there's no kind of pathway that we have laid out specifically for them that they need to follow, that they can do whatever feels best to them.
Great. Dr. Chang, I wonder from your perspective, is there a certain culture that you try to create with your docs to kind of empower them to deliver this type of care to their patients?
Yes, absolutely. And I'd say our culture really ties back to our values as a medical group. It's compassion, courage, inclusion, innovation, and ownership. So with compassion, I always tell people like I truly believe that we chose a career in healthcare for compassion of the patient. And what would our whole practice look like if we were as compassionate with each other and with ourselves as we were with our patients? So that's kind of the beginning of our culture conversations, and then certainly really encourage courage to speak up, right? Speak up on behalf of patients. If you see there's an opportunity for change, like let's pursue it. We can always do something better. Right? And inclusion, absolutely. We want to build a culture where everyone feels like they can belong. And that's for our patients and for ourselves. And certainly innovation, Kaiser Permanente has been innovative since day one, right? Our whole system of prepaid medicine really is different than what's offered in the rest of the United States. So we have been innovative. And then owners, like we own what patients present to us. We take those issues and we own it, and we have to do something about it. And I think, like as we've shared today, the birth of our Gender Pathways Clinic, the birth of Center for Black Health and Wellness, the Salud en Español, those are all in response to what patients told us, and we owned it and we did something about it. So that's the culture that we very much want to nurture, and it's an evolution. So we're not perfect, but we will continue to listen and continue to evolve. So thank you.
Wonderful. Thank you so much. It looks like we're coming to an end of this portion of our time together. I want to thank all of the panelists for sharing so many great stories and your perspectives. It was really powerful, and I feel like I learned a lot. So again, thank you for being here today. We do have a question or two coming in from the group. It's not too late, friends, to put one in to the Q&A. So if you think of something, please do. I'm going to pose the question here, and maybe we could start with you, Dr. Chang, and then others, please chime in on your perspectives to this as well. So the question is, as an employer, many of my employees come from backgrounds that are traditionally underserved in the healthcare space. What can I be doing to support my workforce? I love this question.
Oh, wow. Well, one is just being aware. First is you're being aware of the fact that your employees are not necessarily accessing or feel like they're empowered to access. So number one is that awareness. I think it's incredibly powerful for employers to have paid time off so that people can take time to go see their doctor, access healthcare, and still be able to put food on the table for their families. So having paid time off is an incredible benefit that employers can offer. And then it's also education, just encouraging your employees. So I've seen this come across in multiple different ways, employer groups offering incentives, right? So if patients show that they have quit smoking, or their cholesterol is under control, or their diabetes A1C, the blood sugar level, is under control, and it's attested to by their physicians, they can also earn a discount on their employee paid contribution for their healthcare. So there's different ways that employers can really support the health of their employees.
Thank you for that. I recall having seen a statistic at some point too that said that your manager is almost more influential than like your doctor as far as encouraging people to take care of themselves. So I think it's really important, to remember that we can empower people. We keep using that word today, but I think it's really important to take the time they need to take care of themselves, and also to, model that behavior as well. Any others? Dr. Dahan, would you add anything specific to the trans community, or, some of your patients? How have their employers maybe done a good job of supporting them, or maybe where are their opportunities?
Yeah, I mean, I think part of that, Dr. Chang answered that beautifully, but I think part of that too is making sure that they feel supported in the work where they are at work. I think a huge part of our experience of health and wellness is just what happens in our day to day. So I think asking them, how are you feeling supported in your daily life at work? Are you experiencing microaggressions? Are you experiencing, more than macroaggressions? Is there anything here that we can address for you to make you feel more comfortable in your workspace? I think that if people feel supported and safe at work, and that they feel like they can ask their manager for the time off that they need, and they don't feel like they're going to be retaliated against, or that their healthcare needs, particularly in obviously my patients, like gender affirming healthcare needs and appointments, that they feel safe asking for that, and that they feel safe in the workplace. I think that is really the only thing I would add.
Great. Thank you. Dr. Patel, I have a question here for you, and it's sort of related, but this one says, what resources or tools do you have to help non-English speaking patients understand their health conditions and treatment options?
Yeah, this is a good question. So I not only have Spanish speaking patients, but patients of many, many different languages on my panel. And so I can speak to some of the Salud stuff, as well as what we offer for everybody. So within Salud, we have a lot of things that are translated into Spanish. And so in a patient's after visit, I write in Spanish kind of what they need to do, or when they need to go to the lab, or referrals and things like that. And because I can write in Spanish, I can do that very easily. And we also have in our after visit summaries, we have common conditions in, I think, at least 15 different languages that I've seen. So, for example, if I have a Vietnamese speaking patient in front of me and they're having some shoulder issues and I want to prescribe them some shoulder exercises, I can type in, shoulder exercises Vietnamese, and it pulls up these exercises in Vietnamese that I can print up and I can give to patients. We already talked about how we have interpreter services available kind of in all our departments, and I always tell all my patients that they always have a right to ask for an interpreter, whether they're going to radiology or pharmacy or somewhere else. And specifically for our Spanish speakers, we have our Spanish speaking patients who have diabetes and might need kind of more care with pharmacists managing their medications. We have a couple of Spanish speaking pharmacists who take some of the different areas within Kaiser and work with those patients specifically in their languages. We had a couple of them come to my last group visit and speak with patients about medications too. So we have health educators, pharmacists, and other staff who can outreach patients in their language.
Well, thank you so much for sharing that. Let's see. We've got another question from the audience that I'd like to pose to you, Dr. Chang, and that's around culturally competent care that's outside of just speaking the person's language. The question, I think what they're getting at is how do we address different cultural beliefs and how they may impact someone's decision making, around their health.
Yes, yeah, very important question. And I would say that this is the crux of what we teach. So one thing is for the medical group, all our physicians, as they come in and onboarding, we have trainings around how to communicate with patients. And we actually have a training that you have to complete in order to become a senior partner in the medical group. So part of this training is really key questions that we are taught on how to have conversations with patients, to really understand the cultural, like where a patient's coming from and their cultural context, really asking some key questions. What's important to you? What do you think is going on? And what are your concerns about, whatever it is that they raised? And then at the end, to use something called the teach back method, which is, to make sure that we're on the same page. Please tell me what you understand of our plan today and our agreements today. And so using these key questions really allows us to be open and curious and not make assumptions. And I think that's the key thing, is like being intentional about understanding where the patient's coming from, what they want, what's important to them, how they view their own health, and what are their beliefs tied to it, right? Like we can't tell them, and certainly Western medicine, allopathic medicine, how we're trained is just one understanding of health. There's so many myriad ways of understanding health. And so how can we as physicians help understand where the patient's perspective is, share our medical knowledge and experience, but find a solution and find a way forward that really works for the patient. So that's what we teach.
Great, thank you. All right. Let's see. Oh, it looks like we have one more. This is great. Thank you so much for sending in your questions. This question, let's see. It says, how do you see technology impacting culturally competent care, especially for remote or non-English speaking patients? Dr. Patel, would you by chance want to take that one?
Sure, I can take that. Yes.
That'd be great.
It seems like there are kind of two questions within that. Let's start with the remote patients. So we actually have a lot of patients within Kaiser Permanente who might live kind of out in the country or far more than an hour or two from a clinic site. We have a lot of access to virtual platforms and virtual care. And within our primary care model, each of us do at least half a day a week of virtual appointments. So patients have access to their primary care for virtual appointments, as well as kind of convenient care, Get Care Now, e-visits, other platforms like that, where they can access care and not have to come in, depending on kind of what the issue is. And then the other, can you repeat the other part of the question? I think I want to make sure I answer it correctly.
Yeah, I think that they're just wondering how the technology maybe can enhance the experience for our non-English speakers.
Yeah, and so with those virtual platforms, we can bring in either video or audio interpreters. We can offer that care in person, and we can also offer that care virtually for patients who might not speak English and also be far away, or might not be able to leave work because they're working all day, and they might have just be able to squeeze in an appointment during their lunch shift, but they speak Vietnamese or another language. We can offer those interpreters with our virtual platform too, and that interpretation is really good. I use it all the time.
Great. And Dr. Chang, anything from your perspective that you would add around the technology piece?
Yeah, I would also add that we're using technology to support better interactions between the patient and the doctor. And so one technology tool that we have rolled out to all clinicians across Kaiser Permanente Northwest is the ambient listening clinical documentation tool. So we basically use an AI enhanced platform that listens to the conversation and drafts the notes for us. And in this tool, the version that we use, it can listen to over 30 some different languages. So I was a little skeptical at first. I was happy to try it out and be a pilot test user, and because I really want to make sure it did work in other languages. And so there was a patient who came in speaking Mandarin, and of some Cantonese, and I only speak Mandarin. I don't speak Cantonese. So I had a Cantonese video interpreter, the patient speaking Cantonese with the interpreter, who then translated to English. And then I'm having conversations with the interpreter in English. Then the patient realizes I speak Mandarin, so we flipped to Mandarin, and we went kind of through this 3 different language, cycling through Mandarin, Cantonese, and English. And at the end of the visit, I looked at the ambient listening clinical documentation tool generated note, and it was about 99% accurate. I only had to change 1 word. And at that moment, I was like, okay, I'm sold, because I could be so much more present listening to the patient for that entire conversation rather than trying to take notes as we were talking. And then at that moment, I was like, okay, this tool is really going to improve care experience and ultimately health equity, because we can be really present for our patients.
Beautiful.
Thank
I also
you.
wanted to share that through the center in partnership with Center for Health Research and Learning Health Systems, we created culturally specific animated videos to talk to our members about what is a fit kit test and what is a colonoscopy, what to expect. And so I'm really excited to roll that out officially to our patients. We've gotten a lot of great feedback from our Black Health Advisory Council and CAPA. And really what that video, those videos share is it's reflective of the community that we're looking to serve. So from tone to the aesthetics, we're really, again, intentional about what that looks like to hopefully be able to grab the attention of our patients as well as educate them using animated videos. So.
Cool. Thank you for sharing that. I have not had a chance to see those, but hope maybe I can get in touch with you after this. And Dr. Chang, I actually just yesterday saw a demo of the kind of scribe program that you talked about. It is absolutely incredible. I was blown away. The whole room was blown away. So really cool use of new technology there. Okay, I think we have one last question, and that one is going to go to you, Dr. Dahan. The question is, how can healthcare professionals better identify their own biases and mitigate them in their interactions with patients?
Yeah, so this is a hugely important question, and one I want every single healthcare provider, actually every human in the world, to be thinking about critically every day. And part of that I talked about earlier about recognizing our own positionality. So for example, me being a trans person and me being a queer person, there are things about that I can understand when I see a patient. I know that the biases there are going to be less around those issues, right? Because it's my life, it's who I am. But I'm also 40. I live in an urban environment. I'm white. I have a advanced degree. I grew up upper middle class. There are all these different things that inform how I move through the world, the privilege that I move through the world with, and that those things may not be true for the patient that I'm sitting in front of. And so I really advocate that providers just listen. You just listen. And if your patient tells you that they're experiencing transphobia, they're experiencing racism, they're experiencing sexism or ableism or fat phobia or whatever it is that they are experiencing, that is true. And it is our job just to show up for them, listen to them, and do the best that we can to mitigate those effects via our, our healthcare system and our society at large. I think the most dangerous thing that a provider can do is, or anybody who wants to be an ally, is to say, hey, I'm an ally and I either understand this as well as you do or better than you do. So sometimes there can be very misguided attempts at allyship that can turn very toxic very quickly, where you are now not creating space for the people who are actually experiencing the marginalization, and you are actually perpetuating these systems of marginalization that you have, been attempting in your own efforts to combat. So I think listening, recognizing who you are, where you're coming from, may very well be different from the experience and identity of the person that you're with, and make room for them to tell you their truth.
If I could just add to that, there's not a one size fits all, right? You want to try to right size your care with that patient based on what they're telling you, what their needs are. And this doesn't just stop with the physicians, as Dr. Dahan had said. It's everyone within the system that's interacting or interfacing with members or community. The other piece I would say is understanding and acknowledging that there are biases. We all have them. And so if we don't acknowledge that there is that opportunity, how are we able to move progress forward with advocating for our patients?
Said, thank you both so much. I think that that was a great way just to round out the fact that here at Kaiser Permanente, we really do keep the member at the center. And it is our mission and goal to meet them where they're at and to provide care that brings in all of the components that we talked about today of who they are as a whole person. So I want to take the opportunity again to thank our amazing panel. This was such a gift that you gave us here today. I also want to thank all of you listening out there for submitting fantastic questions. So what's next? You'll see coming up on the screen here that there are opportunities to get a behind the scenes look at how we do this at Kaiser Permanente. I will say I just was in an Experience KP tour yesterday with a group. If any of you are watching, hi. It was such a powerful experience. There's nothing else like it to get a sense for how the magic sort of happens here at KP. So really encourage you to reach out to your account rep. If you have not had an opportunity to do this yet, we would love to be able to share with you some of these special programs and how that integration has an impact on our members' lives and health. I want to let everybody know that you will be receiving some tools and resources, how to support your employees and groups. That will be sent out to you following today's presentation. Let's see. Any other housekeeping items that I was supposed to remember to do? I got so caught up in the conversation today that everything else has sort of gone out the window. I think there might be a survey coming your way. Would really appreciate your feedback. We want to bring content that is important to you and your employees. So please do take a minute to do that when you see that come through. All right, with that, have a great day. Have a great fall. Enjoy this nice, cool weather that we're having in the Pacific Northwest. And again, thank you so much to our panel. It was a fabulous discussion. Appreciate you.